It's Thursday, July 8th, and time for your Barbados Today morning news update. CARICOM will need to investigate the reason behind vaccine hesitancy if it is to come close to its goal of achieving 80% herd immunity against COVID-19 within the region. That's according to President of the Barbados Association of Medical Practitioners, Dr. Linda Williams, who believes qualitative research is needed to get to the bottom of the situation. Her comments come on the heels of Tuesday's report by CARICOM Chairman Antigua and Barbados Prime Minister Gaston Brown that CARICOM heads of government had taken a decision that the regional grouping would try to achieve 80% herd immunity by the end of this year, but were concerned about a vaccine hesitancy. In an interview with Barbados Today, Dr. Williams said that in order to sway people to get inoculated against the virus, it was necessary to know why they were hesitant to do so in the first place. At the same time, the Pan American Health Organization has raised concern about what it said was the stark inequities of COVID-19 vaccine access. During PAHO's weekly press conference on Wednesday, Director Dr. Caricia Etienne said, while several countries have done a remarkable job in vaccinating residents, others are struggling.
But for every success, there are several countries that have been unable to reach even the most vulnerable in their population. Millions of people in Latin America and the Caribbean still don't know when they will have a chance to be immunized. Haiti, for instance, has yet to start vaccinations. Jamaica is also struggling to access enough vaccines to cover their high priority groups. Some countries in South and Central America, where the pandemic has hit particularly hard, have not yet been able to access enough vaccines to fully vaccinate 3% of their populations. The 24 million doses of COVAX deployed in the region so far have been quickly put to use, and countries are eager for the additional allocations to ship as soon as supplies are available. Our countries know how to deploy vaccines and are ready, but they need more doses, and they need them now.
She made it clear that there was a need to reduce inequality in vaccine access.
It is not yet time to roll out boosters when millions have yet to receive one dose. 1, 2 shots and 1 shot regimens have proven effective long after they're administered, and sticking to them will allow us to protect more people. We should ensure that those at greater risk, like health professionals and the elderly, are protected everywhere before rolling out limited doses to healthy children. Vulnerable populations such as migrants and indigenous groups should be prioritized with programs that take their needs and the culture into account. COVID-19 has taught us that when some are left behind, all of us are at greater risk. The vaccines that we have at hand work remarkably well and will help us overcome the pandemic. But only if we take this opportunity to address the challenges that have long held us back, especially the pervasive inequality in access to health.
The Democratic Labour Party's presidential candidate, Reverend Guy Hewitt, maintains he has widespread support among the party. He made the claim on Wednesday during a virtual meeting hosted by the UK Bajan Hub in response to the membership's request to hear his views and opinions on his eligibility for the party's presidency. In response to suggestions that current President Verla de Pisa had strong backing within the party, including support from over 16 constituency branch offices, Hewitt said that was not true. He said he was aware that there are a number of branches that have not given de Pisa a nomination. He further stated that there was mixed thinking on the ground in the DLP on the issue of leadership. The University of the West Indies Cable Campus launched a new research and policy unit to strengthen the relationship between law and health. The Faculty of Law Health and Law Research Unit will allow for knowledge generation and awareness building in the field. The new unit will also be tasked with providing technical assistance to government and civil society on law and policy reform and implementation, as well as possible strategic litigation. Deputy Dean of the Faculty of Law Nicole Foster noted that the unit is also intended to act as a hub for work by regional experts, advocates, and practitioners.
The timing of this launch could not be more relevant and urgent. Currently, NCDs are the leading cause of mortality, disease, and disability in the Caribbean, representing almost 8 out of every 10 deaths in the region, approximately 1/3 of which are among persons aged 30 to 70. The Caribbean subregion also has the highest mortality from NCDs in the Americas and the highest rates of childhood overweight and obesity in the Americas. These sobering statistics are a wake-up call for us all, especially considering our COVID-19 experiences, and highlight the need for a redoubling of our efforts and a commitment to making full use of all the tools at our disposal to win this battle. Law is one such powerful tool. Indeed, 10 of the 16 WHO Best Buys require the effective use of law or regulation, and notably, these are precisely the interventions where our regional response has been weakest to date.
There's regional and international news after this short break.
Barbados Today, news you can trust.
In regional developments, we continue to track the situation in Haiti. The United Nations has strongly condemned the assassination of Haitian President Jovenel Moïse. In a message read by spokesperson Stéphane Dujarric, UN Secretary General Antonio Guterres called on Haitians to reject all violence and remain united in the face of what he described as an abhorrent act.
The Secretary General condemned in the strongest terms the assassination of President Jovenel Moïse of Haiti. The perpetrators of this crime must be brought to justice. The Secretary General extends his deepest condolences to the people and government of Haiti and the family of the late president. The Secretary General calls on all Haitians to preserve the constitutional order, remain united in the face of this abhorrent act, and reject all violence. The United Nations will continue to stand with the government and people of Haiti.
And finally, the World Health Organization reported that the global death toll from the COVID-19 pandemic climbed to 4 million on Wednesday. WHO Chief Dr. Tedros Adhanom Ghebreyesus announced the grim tally of lives lost over the past year and a half, adding that the pandemic's true toll was probably higher.
The world is at perilous point in this pandemic. We have just passed the tragic milestone of 4 million recorded COVID-19 deaths, which likely underestimates the overall toll. Some countries with high vaccination coverage are now planning to roll out booster shots in the coming months and are dropping public health social measures and relaxing as though the pandemic is already over. However, compounded by fast-moving variants and shocking inequity in vaccination, far too many countries in every region of the world are seeing sharp spikes in cases and hospitalization. This is leading to an acute shortage of oxygen treatments and driving a wave of death in parts of Africa, Asia, and Latin America.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.